Certified Medical Assistant Practice Exam. Which of the following planes divides the body into anterior and posterior portions? Transverse. Which of the following systems pumps and distributes blood throughout the body? Cardiovascular. The four major types of tissue in the body are muscle, nervous, epithelial, and connective. The upper respiratory tract includes all of the following except the bronchi. The accessory organs include the gallbladder, liver, and pancreas. Hydrocele means swelling of the testes. All of the following are true about leukocytes except leukocytes are responsible for blood clotting. Tendinitis is an inflammation of the tendon. The function of the skin includes all of the following except transportation of immune cells. The nucleus is the control center that directs the activity of the cell. Cholelithiasis is gallstones. The sensory organs include all of the following except the pharynx. Which of the following terms means the surgical removal of the kidney? Nephrectomy. The combing form cost refers to which of the following anatomic structures? Rib. All of the following components are a part of the Sigmund Freud's theories of psychology except behaviorism. Which of the following terms means difficulty swallowing? Syphagia. Cognitive theory offers an approach to psychology that encourages individuals to examine errors in their thinking. Which suffix means surgical repair? Plasty. Which of the following conditions is commonly known as a bruise? Hematoma. Each of the following identifies one of Elizabeth Kubler-Ross's 5 stages of grief except shock. The most accurate definition of defense mechanisms in psychology is strategies individuals use to avoid difficult or painful feelings. All of the following statements about renewing the CMA credential are true except the CMA credential is required in order to practice in the medical assisting profession. Which certifying agency allows a medical assistant to use the CMA credential? Commission on Accreditation of Allied Health Education Programs (CAHEP). Which type of resume is written specifically for an advertised job? Letter of recommendation. Which of the following incoming calls should the medical assistant transfer immediately to the physician? The emergency room calling about admitting an established patient with chest pain. A physician who specializes in disorders of the eye is known as which of the following? Ophthalmologist. Patient's employer. A patient's neighbor calls, stating that she is concerned about her friend and would like to know what is wrong with the patient. The medical assistant should tactfully refuse to release any patient information without the patient's written permission. When responding to a hearing-impaired caller, the medical assistant should speak a little more slowly and little more loudly. The best way to handle an unidentified caller who insists on speaking with the physician but refuses to give her phone number or the reason for her call would be to ask the caller to send a letter to the physician. Which of the following conditions is most characteristic of an asthma attack? Dyspnea. To obtain confidential patient information, which caller does not need a patient's written consent? Referring physician. Which of the following situations is not considered to be a reportable incident? A negative result for HIV. Which of the following terms means the thing speaks for itself when applied to the law of negligence? Res ipsa loquitur. Which type of insurance would cover the medical expenses of an employee injured on the job? Workers' compensation. All of the following are reasons for the proper documentation of procedures performed in a medical office except information documented in the medical record may be used to reassure an employer about the health of an employee. Which of the following terms refers to the narrowing of the urethra? Urethrostenesis. Which of the following is the correct spelling of the term for an enlarged spleen? Splenomegaly. The Personnel Record Act prohibits an employer from keeping information about an employee's political affiliation. Which of the following is an example of an open-ended question? Would you please describe the exercises you do each day that tend to cause the chest pain you are experiencing? When should the W to form the wage and tax statement be given to an employee? Annually in January. All of the following may interfere with the therapeutic relationship between the patient and the healthcare provider except empathy. Which of the following statements would be an example of stereotyping? All elderly patients have difficulty walking. Which of the following terms refers to the surgical removal of a lymph node? Lymphadenectomy. Which of the following is not considered a special accessibility alteration designed just for disabled patients coming to the physician's office? Mats on the floors near entryways to prevent patient falls because of wet floors. Which organization registers physicians to prescribe controlled substances? Drug Enforcement Administration. D. Which of the following describes a wrong and unlawful act performed by a physician? Malfeasance. A legal, valid contract may include all of the following except any to individual. Which of the following terms describes written statements made to damage an individual's reputation? Libel. All of the following actions may result in revocation of a physician's licenses except prescribing legal drugs. A healthcare agent with durable power of attorney is the person chosen to make the final decisions about the patient's end-of-life healthcare. Which of the following situation is not considered to be a reportable incident? Case of bronchitis. The Occupational Safety and Health Act was legislation passed to ensure all of the following except more control for employers over employee non-worker hours. Which of the following federal agencies was formed as the first attempt to establish consumer protection in the manufacture of drugs and foods? FDA. Food Drug Administration. The Clinical Laboratory Improvement Act of 1988 was developed for all the following reasons except to increase the waiting time for specimen results. All of the following accommodations may be made to comply with the regulation as recommended in the Americans with Disabilities Act except replacing stairs with elevators in all buildings. Which of the following terms states that a physician is liable for the negligent actions of any employee working under his or her supervision? Responded superior. The process of preparing documents by converting dictated physician notes into written documents is called transcription. Which of the following would be the best salutation to use in a business letter? Best regards. Which device protects a computer from electrical damage? Surge protector. All of the following are examples of computer hardware except system software. Which of the following is a pointing device that notifies the user where the next letter, number, or symbol will be placed? Cursor. Which of the following is not a subjective symptom? Fever. Who owns a patient's medical record? The information in the record is owned by the patient, and the physician or medical facility that created the record owns the paper medical record. Medical records are used for all of the following reasons except to keep track of the patient's financial transactions. Medical records are classified as closed, active, or inactive. Which type of medical record filing system offers the most privacy? Numeric. All of the following are advantages of the numeric filing system except an alphabetic card system. All of the following statements describe strict chronological filing except the problem list is arranged according to the patient's past history. Which of the following would be considered an example of objective clinical evidence? High blood pressure, elevated temperature, and swollen ankle. All of the following should be considered when selecting the file cabinets for a medical office except whether or not the office uses color-coded files. Which type of mail should be used when proof is needed that patient received a letter sent by physician's office, certified mail? How many digits are contained in the zip +4? 9. Where on an envelope should notations such as confidential and personal be included? Type directly below the return address. Correct USPS abbreviation for the state of Maine. Math procedure to follow when opening mail is to place the most important mail on top. Annotating is jotting down notes about an action needed to be taken in the letter's margins. Which of the following should be placed on the top when sorting incoming mail? A letter marked personal. Which of the following patients should be seen first if all of them arrived at the walk-in center at approximately at the same time? A 56-year-old male with dyspnea. Which type of scheduling system schedules 3 patients at the beginning of each hour? WAVE. CPT codes are used to code procedures. Medicare Part B covers all of the following except inpatient hospital visits. Which part of Medicare provides prescription? Part D. Tricari was formerly known as Champus. Which of the following coding systems is used to identify and code diseases on insurance claims? ICD-9-CM. Which type of ICD-9-CM code is used to classify external causes of poisoning and injuries? A codes. Which terms is used when describing the amount of money owed by the medical office for products and services purchased on credit? Accounts payable. The role of the medical assistant when checking in a patient is to confirm office coverage for patient's insurance plan. When an insurance policy pays a percentage of the balance after application of the deductible, it is referred to as coinsurance. When more than one policy pays on a claim, it is called coordination of benefits. When both parents married are covered by health insurance, claims for the family are paid according to the birthday rule. A method of containing hospital costs has been adopted with a system called DRGs. Which of the following is not a federal health insurance program or state health insurance program? UMCOs. What percentage will Medicare pay on an allowed claim? 80%. Mrs. Lee, a patient of Dr. Chad, is charged $80 for a visit. Medicare allows $60 for this visit and paid $48. Because Mrs. Lee has already met her yearly deductible, how much will she have to pay the physician? $12. Which volumes of the ICD-9-CM books are needed for coding diagnoses in the medical office? Volume 1 and 2. Place the following medical records in alphabetic order, 23, 4, 1. Codes that cannot stand alone are B codes. Insurance policies that include coverage on a fee-for-service basis are called traditional insurance policies. Which of the following will happen to an insurance claim when the coding is incorrectly entered on the insurance form? The claim will be denied, and the physician will not receive payment. Which of the following is the final step to the aging and collection process for a patient with private insurance? Send an overdue notice with the intent of turning the bill over to a collection agency if not paid promptly. Non-duplication of benefits means that benefits will be coordinated between two separate insurance companies. Medical expenses for a patient injured at his or her place of employment should be sent to Workers' Compensation Insurance. Which of the following information will be listed on the front portion of the patient's Medicare card? The name of the beneficiary and the patient's ID number. Which of the following individuals would require the consent of an adult before treatment may be given by a physician? A 15-year-old girl living with her parents. Which of the following criteria is an example of the clustering style of scheduling? Scheduling a well baby clinic for Tuesday mornings from 10 o'clock a.m. to 11 o'clock a.m. and performing school physicals one morning per week. Which scheduling style utilizes any method or combination of methods that works best for the individual office? Practice-based. Which of the following best describes the prior permission or approval needed from an insurance carrier before a patient may be treated or have a specific procedure performed by the physician? Pre-certification. Which of the following would be an example of an accounts receivable? Charges for a patient's office visit. A one-write or write-it-once bookkeeping system is also referred to as a pegboard system. All of the following are ways to help in the collection process of accounts receivable except allowing 3 months to pass before billing the patient for the office visit. Which of the following is the safest type of check endorsement? Restrictive endorsement. Payroll documents of employees need to be kept for a minimum of 4 years. The money collected through contributions to the Federal Insurance Contribution Act (FICA) is used for all of the following except unemployment insurance. Which type of insurance is usually purchased to cover catastrophic illness and injuries? Major medical. The usual fee charged by a physician is the amount a physician charges for a service or procedure. Which law protects consumers by requiring full disclosure of any additional charges that may apply to a bill, such as interest? Truth in Lending Act. Which of the following statements is not true about patient referrals? They may be made without pre-authorization from the insurance carrier. Which of the following statements describes a patient advocate? A liaison between patient and healthcare provider. Which of the following terms may be defined as the science of designing equipment in a workplace to help workers reach maximum productivity and reduce fatigue and discomfort? Ergonomics. Which of these laws or organization developed rules regarding the proper handling of blood products and other infectious materials such as wearing gloves, gowns, and goggles? Center for Disease Control and Prevention. All of the following are requirements for safety in the medical office except exits marked only in Braille. Which of the following is not an example of biohazardous substance, perspiration? All of the following are bookkeeping guidelines except completing bookkeeping once every 2 weeks. All of the following statements are true about the encounter form except an encounter form is considered the universal insurance claim form. Which of the following medications should be included on a crash cart? Furosemide Lasix. After delivering a shock with the AED, the medical assistant should immediately resume chest compression cycled with reassured breathing. An AED is used to treat which of the following? Heart arrhythmias. The medical assistant is protected from liability during an emergency situation for all of the following reasons except The patient agrees to treatment. The medical assistant is caring for a child with a painful, blistered burn on the arm from a hot liquid. The medical assistant should apply ice directly to the burn and keep it there until the pain is relieved. According to basic cardiac life support procedures, which of the following describes appropriate rescue breathing for an adult patient? 1 breath every 5 seconds. To control bleeding or hemorrhaging, the medical assistant should initially apply direct pressure, which burn destroys the epidermis and dermis, including the nerve endings, 3rd degree. A strain is a muscle injury. Which of the following should be assessed first when rendering first aid? Airway. All of the following are common causes of breathing emergencies except strains according to the rule of nines. The amount of body surface represented by the head and neck is 9%. Shock is caused by a lack of blood flow and oxygen to body tissues. What is seizures? An involuntary muscle contraction, relaxation. Insulin shock causes severe hypoglycemia. When using an autoclave, which of the following is the minimum temperature necessary to sterilize medical instruments? 250 degree F 121.1 degree C. Which of the following is one of the agencies that regulates the disposal of infectious waste outside the workplace? Environmental Protection Agency. Which of the following terms describes complete destruction of all microorganisms? Sterilization. When a patient has taken a drug for an extended period of time, the desired effect may lessen or will not occur at all. This is called tolerance. Which of the following agencies is responsible for enforcing the Controlled Substance Act? Drug Enforcement Administration. Which of the following is a drug used to lessen or prevent the effects of a disease? Prophylactic. Which of the following food types is the best protein source? Meats. Which of the following is the best source of calcium and vitamin D? Dairy products. Which type of pathogen survives in the absence of oxygen? Anaerobes. Which of the following is an effective disinfectant used in the medical office to destroy bloodborne pathogens? Bleach. Which of the following is an example of a standard precaution for infection control? Disinfecting the examination table after each patient. Which of the following describes a drug that is not protected by a trademark but is registered by the Food and Drug Administration? Generic. A physician prescribes amoxicillin 500 mg capsules per quid for 10 days. How many capsules should be dispensed? 40. A drug from which of the following classes is used for a heart condition? Antiarrhythmic. The food guide pyramid suggests that patients plan a balanced diet by doing all of the following except eating more carbohydrates. Which of the following is an example of a fat-soluble vitamin? Vitamin E. Which of the following terms means all of the factors required for infectious disease to spread? Chain of infection. Which of the following is the first line of defense in the practice of medical asepsis? Washing hands. The medical assistant is to obtain the history of a patient who is suspected to have active tuberculosis for protection. Which of the following articles is essential for the medical assistant to wear before entering the room? Mask. Substances that prevent or inhibit the growth of a fungus are known as fungicides. A drug that is given sublingually is placed under the tongue. Calculate the following drug dosage. Ampicillin 0.5 grams. The unit dose packet reads 250 milligrams. Cap. 2 capsules. High-protein diets are often used before surgery. The recommended amount of water to ingest daily is 8 8-ounce glasses. Biohazardous waste must be collected in impermeable polyethylene bags that are which color? Red. Which of the following body parts is considered the lower limit of a sterile surgical field? Waist. Gloves, gowns, and face shields or masks are example of personal protective equipment (PPE). Which of the following types of infection has a quick onset and a short duration, similar to the common cold, acute infection? Which of the following are liquid at room temperature and may help reduce blood cholesterol? Unsaturated fats. Where is the most common intramuscular injection site for infants less than 7-month-old? Vastus lateralis. What is the subscription part of a prescription? Directions for the pharmacist.